Hey Lindsay, how's it going? I'm Dr. Potter. I'm just a physical therapist here, gonna check you out, see what's going on with your neck pain. And I understand that you have an MRI that you're pretty concerned about with that neck pain, is that right?
Yeah, that's right.
Okay. So one thing is obviously, I'm glad that you've gone and talked to medical professionals about your issues, try and get them sorted out, and I can make you a good promise that we're going to be able to help you. So that should be some good news. And with that MRI, I also want to make sure that you understand, because it seems like you're a little bit nervous about that, a little bit concerned and anxious about those results. Is that right?
Yeah, they told me that I have degenerative joint disease, which is just kind of really scaring me and worrying me, especially because I have a lot of pain.
Yeah, it sounds scary too. I mean,
Right,
it's
yeah.
this long word that you might not even know exactly what it means, and sometimes we can see something on an image like an MRI and have that test done, and the actual source of any pain doesn't necessarily show up on the MRI. And what I mean by that is a few years ago there was actually a study done where a lot of people who on one side they had back pain, and then on the other side they didn't have back pain, and they MRI'd all of their backs, okay? And what they found actually was that the MRI was very unlikely to be able to find the source of pain, because a lot of the people without back pain actually came in and they had some things wrong with their spine, and a lot of the people who had severe pain and chronic pain, their imaging actually showed that they had nothing wrong with their spine. So one thing I just want to make sure that you understand is that by no means am I trying to tell you that your pain is not there or that it's wrong or that you're wrong, because it's definitely something you're experiencing, so we're going to help you with that.
Okay.
But don't worry too much about that MRI, okay?
Okay.
So one of the things that we're going to talk about with pain is just kind of right here. I like to use this image to help you understand a little bit about what you're experiencing. So with that chronic pain that you've had, there's something called central sensitization. So this knob shows it perfectly. When your body is in pain, sometimes the brain, to try and save itself or protect itself, will kind of dial it up to 11 and will make you feel like you have so much pain to try and protect those tissues. So in this case, your neck. So in the past, you may have had some pain, and now your brain is telling you that you've got pain in that area, and maybe even more than you have had before. So it's more sensitive because it's trying to help you make sure that you don't do anything that might hurt it, okay? But what we actually see in the studies that are done is that we can help bring this back down to a normal level, where sometimes you might experience pain when you move a certain way or something, when there might be an issue, but that you don't have to experience that kind of chronic pain. And so something that can contribute to that sensitization, where your pain has been dialed up to 11, are different things in your life that add stress. Now, you were telling me that you had quite a few things, really, or adding stress. Is that right?
Yeah, that's definitely true. Yeah, I feel like just my home life in general is kind of one of my big stressors. So
yeah, and that's actually something else that can bring your pain up. When your brain, when your body is telling your brain that you are stressed, okay, your brain makes it easier to feel pain, because then you're better able to protect yourself. Okay, it's just a protection mechanism.
Okay.
And so one thing that we can do is try and mitigate those things, try and help some of those things that are causing you anxiety, as well as put you through the therapy of actually moving and making sure that we're actually getting your neck functional, as well as helping with some of those things like that depression, anxiety you were talking about.
Okay.
Are those things that you've been able to get any help with, or would you like some referrals to try and get that helped?
Yeah, I mean, I think I would like some resources. I don't really have anyone that I've gone to. I've kind of always just dealt with it myself, so I think it might be nice to talk to somebody. Yeah.
Awesome. So I've got a really good connection here, actually just right across the street. We've worked with them often, and they are really good at getting just right to the problem, not wasting any time, and helping you to kind of solve some of those issues that might be in your life, helping with those anxieties. And you'll find that as you come both to me and maybe use that resource, that you'll find your pain levels start to go down.
Okay.
and that you feel a lot better. Okay, so let's go forward with that. Sound good?
Yeah, I'm willing to try whatever.
Awesome.
Sounds good.
We're going to get you better.
All right.